Thank you. And this meeting is using teleconferencing as a precaution, and it will be done not physically in attendance, but via video conference. And the instructions on how to submit public comment are on the agenda that was posted. And so we will move on to convening the meeting and calling the roll, which will serve as our introductions. And Darlene is going to be clerking us today. So
yes, thank you, Madam Chair. Okay, for roll call, Councilmember Sauce.
Yes.
Councilmember Hudson.
Yes.
Councilmember Anderson.
I'm here, but I'm not really council member, but I'm a
Correct, Supervisor
No,
Anderson.
but I used to be one and I loved being one, so that's good.
I will make note of that. Councilmember Worth.
Here.
Vice Chair Stepper.
Here.
And Chair Geringer.
here.
Okay.
And thank you very much. And could you, Darlene, let us know other staff members, or shall we? Actually, why don't others turn on your camera as you are interested and introduce yourselves. And I see Sia, I see you first, and so then everybody else can.
Yeah, sure. Sia Shoja, traffic engineer, City of Lafayette.
Okay, and Ricky.
Ricky Wells, BART.
Thank you, welcome. Andy.
Everyone, Andy Diller, Town of Danville staff.
Thank you. Jason.
Hi, Jason Chen, City of Orinda staff.
Great. And then coming down on my screen, Terrence.
Terrence with Fair and Pierce.
Welcome. Eleanor.
Eleanor Leshner with Fair and Pierce. Thanks for having us.
Thank you. And Robert, welcome.
Robert Sorvento, Contra Costa County staff.
Thank you. And Colin.
Colin Clark, Contra Costa Transportation Authority, Planning Department.
Thank you. And Ruby.
Ruby Horda, County Connection.
Welcome. And Brian.
Yeah, good afternoon. Brian Bornstein, City Engineer, City of San Ramon.
Great, thank you. Well, welcome to everyone, and you can turn your cameras off if you'd like, but welcome and thank you for introducing yourselves. We'll now move on to agenda item number 2, which is public comment, and members of the public are invited to address the committee on any items, regarding any items that are not listed on this agenda. Do we have any members of the public or any members of the public who wish to speak? I don't see anyone other than who has been already introduced. So we will move on to item number 3. Is there any board member comment? Any members of the board wish to comment on anything? Okay, moving on to agenda item number 4, administrative items. And Darlene, do we have any administrative items? I believe.
Yes. Oh, sorry. Yes, Madam Chair, we do. So due to further clarification, the May 3rd SWAT meeting will be deferred to the August 2nd SWAT meeting.
Okay, so we're going to, staff is asking that we table item 5A, approval of the minutes of the May 3rd meeting until our next meeting in August. And so we will do that, and we will move on to the consent calendar. Do I have any questions or comments about the consent calendar, or may I have a motion to approve the other item that's on the consent calendar? We're removing.
I'd like to move the amendment, the MOU of understanding to appoint San Ramon as the administrative staff.
Yeah.
I'll second that. Or Amy can second.
No, either one, Candace, you take it.
We just don't want Dave to cancel it, that's all.
Right.
I'm trying to get in there quick.
Sorry, you gotta just jump.
I know where it's like the Jeopardy, who can get on the button the fastest. So
we need a buzzer with a timer that lock us all in as to who did it first.
So we do have a motion on the table. Do we have any discussion, or are there any members of the public who would like to comment on the consent item? And since I still don't see any additional members of the public, we have a motion from committee member Stepper and a second by Supervisor Committee Member Candace Anderson. Darlene, will you please call the roll call vote?
Yes. Councilmember Hudson,
Aye.
Supervisor Anderson,
Aye.
Councilmember Worth,
Aye.
Councilmember Sauce,
Yes.
Vice Chair Stepper,
Yes.
and Chair Geringer.
Yes. Anybody
All right,
say I was on
passes.
mute?
All right, 6-0 passes.
Thank you. And now we will move on to our regular agenda items. And our first agenda item is to receive an update on the countywide Vision Zero framework. And we're welcoming Colin Clark from CCTA to give us the update. This is an information only item and there's no action required. And so Colin, take it away.
Thank you very much. So Colin Clark, Contra Costa Transportation Authority Planning Department. I have with us here today Farron Piers, Eleanor Leschner, and Terrence Zhao. And this is a follow-up based on SWAT's input and questions from the March meeting. And so one of the main requests was to be able to speak directly with the consultants and ask any questions they may have. But first, we're going to start off. Eleanor has some slides to specifically address some of those questions. And depending on some of the topics that we cover, I can certainly pull up slides as well.
Great. Thanks, Colin. Let me share my screen. Can everyone see a slide that says safety priority locations methodology? Okay.
Yes.
Yes.
Great. Thanks for confirming. So as Colin mentioned, we understand there were a couple of questions about the safety priority locations that were shared in an earlier meeting. And so Terrence and I are here today to just do a little bit of a deeper dive, talk about our methodology, and answer any questions that this group may have. So I think at a high level, safety priority locations were determined using an approach that's typically described as a high injury network. And this is a very common methodology that we use for Vision Zero and systemic safety studies to understand which corridors or roadways within a city or county, whatever the study area is, which have the highest concentrations of collisions. And so we look at this as one way to look at this is a two-step process. There's the algorithmic approach and then the corridor smoothing process. And so we first determine which roadway segments have the highest concentration of fatal and severe injury collisions. And then we extrapolate those trends to the corridor level by looking at contextual and built environment factors like roadway speeds, number of lanes, just to name a few examples. And I'd like to pass it over to Terrence, who's one of our GIS and safety analysis experts, to do a little bit of a deeper dive.
Okay, thanks, Eleanor. So yeah, as Eleanor said, there's basically two steps to this process. The first step is really where we take that collision information. So we have a record of all the collisions that are happening on our roadways, and we're taking that to map those two locations. So what we do is we take the roadway segment and we chop them up into like these little tiny pieces. That way we have a fine grain analysis that they're about 100 feet or so long each. And we just look at how many collisions are happening in each of these little pieces of roadway. And we assign different weights depending on the severity of the collision, because obviously the collision that's resulting in someone getting killed or severely injured is going to be of a different gravity than just your typical collision where there might just be some scrapes and bruises. So once we have basically a tally of how many collisions happen on each of these little pieces, we just rank them in terms of most to least, and with the implication that those little segments with the most number of collisions are the ones that are most deserving of our attention, those are the safety priority locations. So what we end up with is a map with those highest injury little segments highlighted. And you kind of have a map that looks like a little connect the dots map, that you can see those corridors, but they're not exactly contiguous because of various factors. So for example, those segments right next to intersections are going to be probably more collision heavy than those just mid-block. And so what we do is do the step 2 process, which is smoothing, which is where we just play connect the dots with those segments we've identified. Now, obviously, we're not just drawing random lines on the map. We take into account, like, is this actually a continuous corridor? Like, is it the same number of lanes, same speed limit, same really general characteristics? And only then do we say, okay, so this looks like just one continuous corridor of possible, or continuous corridor needing safety improvements and needing possible new projects. And so that's when we connect them. Or alternatively, we see, oh, so maybe this segment is different from that segment. So that's when we say, okay, we don't connect the dots maybe because there's a material difference there. And so, we take these dashed lines and we connect them into sensible, actionable, continuous lines.
And if I could just jump in there, Terrence, just to add that the reason, one of the reasons that we believe it's important to look at it at the corridor level, well, one reason is just so that we can look at something that makes sense to look at a project level, as well as thinking proactively about safety, because we know that there are certain risk factors when it comes to roadway safety. And for example, just because a collision has happened at one intersection but not another in a very similar corridor, we can take a more proactive approach by understanding that, if there's a certain, speeds, number of lanes, trying to think what else, if there's a right turn slip lane, for example, or other built environment factors in one location, we can think that a similar location, we could proactively address a safety concern there, even if a collision hasn't occurred there in the past. And then I think just the last bullet on this slide was that in our case for this project, similar to the approach I think we would take on most of these projects, we gather feedback from Vision Zero working group members that are made up of the Countywide Bicycle Pedestrian Advisory Committee, the RTPC TAC members from all of the different groups across the county, as well as we have several safety experts, including UC Berkeley Safe Track directors on our working group. And so we got feedback from them on both the methodology as well as the draft maps to, let us know if there's any, if we should extend the corridor like Terrence was saying, or, remove certain corridors and dive deeper. So that's the process that we've gone through to create these networks, which I believe were presented at a previous meeting. This is the map of South County for collisions involving people walking. And I understand in a previous meeting, there was a question about whether the data looks at collisions in Contra Costa County and or Alameda County. So just to confirm, we're only looking at Contra Costa County for this effort. We did not look at any collision data in Alameda County. We also have the map with the collisions involving people bicycling, which is a little bit different, but there is some overlap. And my last slide here is just a comparison of the number of miles in these countywide safety priority location maps that fall under each of the regional transportation planning areas in Contra Costa County. And with that, I think we're happy to open it up to questions. If anyone has anything, thank you.
Thank you. And if you could take the turn share screen off, that would be great. And then I would be able to see all the smiling faces. And I see that Commissioner Worth or Committee Member Worth, Amy, has a comment or question.
Hey, thank you, Madam Chair. I wanted to follow up. Thank you for that presentation for a little bit more understanding in terms of the methodology. But I did want to, if you might be able to go back to the map. I guess it's not in our packet. I tried to pull it up in my packet, but so we have it on the screen. I think that one of the concerns that I recall from the previous time, these maps came to us, is that they really just show partial walking areas. I mean, look at the first one. It looks like nobody walks from Moraga to Orinda, or nobody walks from Walnut Creek down to Alamo. I mean, and I recognize that there may be a different framework that puts you into these areas, but I kind of think this is moving forward. So I wondered if you might be able to explain more thoroughly why both in the bicycle and the pedestrian pathways, it's for our purposes, it's pretty much limited to certain areas and doesn't include other areas.
Yeah, thanks for that question. So I guess to clarify, what these maps are showing here are essentially the corridor segments that have the highest concentration of fatal and severe injury collisions. And this is based on, I should mention, data that we looked at between 2008 and 2017, which was the latest data available when we started this effort in 2019. So it's based, primarily on that historical collision data, as well as Terrence put it, connecting the dots to create somewhat more contiguous corridors. So it's not just a bunch of little dots across the county. The other point I'll make is, since we're looking at it at a countywide scale, the ranking that Terrence mentioned compares all of the segments in South County to all of the segments in the whole county. So that may be part of the reason why, like, for example, if we were to look only at South County and then rank things, you might include more roadways, for example, but since we're comparing it to the whole county, this is what pops out compared to other locations in the county where there are higher numbers of collisions. And the last thing I'll say is it doesn't necessarily reflect where people are walking today. As part of the countywide bicycle and pedestrian plan, we did develop what we're calling priority pedestrian areas in the county. I don't know if I have a map handy of that, but that reflects kind of where people are walking, and a little bit to your first question. Does that help?
Yeah, I guess the challenge is that our members of our communities are going to look at the SWAT map. That's or the local communities are going to look at their local maps. And I think our goal with this plan, even though we're looking at a piece of the countywide plan, is to really create safer walking and bicycling corridors everywhere. So I'm just kind of struggling as to how we will use this in communicating with sort of the public, and in identifying these areas of concern about safety, and then how we use this locally. Again, and the other thing is that would be helpful, and I know you probably have this in the report, is to look at the numbers that go with the lines also. Mm-hmm. But I just really think that that having these safe multimodal corridors is just one of our highest priorities. I mean, we've certainly learned that this last year and a half with the COVID, in that so many more people are walking, people are using bicycles, and our biggest, one of our biggest challenges is getting the resources to create these corridors. So that was my only, my thing is, how do we take this and kind of use it to really promote and compete for funds, now regionally and that sort of thing. So.
Yeah, no, that's a great question. And then I guess just to clarify that this exercise is looking at, the past collision history and the similarities of the corridors, but is not necessarily recommending specific projects that may come out from local jurisdictions or from the countywide bicycle and pedestrian plan, which this is a follow-on step to that.
Okay, thank you.
Yes, just to add to Eleanor's point, this is also not, for example, a countywide like walking network map, or like a proposed like countywide sort of backbone network of trails. It's more, these are the locations where we're seeing people get hurt the most and are most in need of safety improvements.
See, I would argue that if we're using an example in Orinda, we need a safe, good bike pathway that goes under Highway 24. And so we would compete for that funding. We'd put together a grant. And if you look at that map, it shows like, well, there aren't any problems under Highway 24. Well, there was a bike accident a couple weeks ago, so we know there are. So that's my question: is this going to help us? Is it going to hurt us in terms of recognizing that each one of our communities has these corridors that aren't safe and need to be safer? And so I guess the other thing is, what are the numbers behind each one of those corridors? So for example, if you look at Moraga to Lafayette, and I know St. Mary's Road, boy, the brave souls that go down there that ride their bikes, they're way ahead of me. So are we talking about, what's the level of magnitude? And thank you, forgive me for kind of drilling into this, but that was the other question that I had relative to these corridors.
Yeah, no, these are great questions. And I think, I wonder if Colin wants to say anything about how CCTA plans to use this information, but this can be kind of one data point or one factor in making those decisions, like you mentioned, in terms of selecting projects. And just to your point on the interchange location, that is definitely something that we've heard all across the county. It's not part of this presentation today, but one of our common collision profiles that we saw across the county was at interchange location. So I think through that avenue, that example you just gave is kind of captured in the work that we're doing as well.
Great.
Yeah, and I'll just add really quickly that the deliverable coming out of this effort that was from the 2018 countywide bike and ped plan that asked for a Vision Zero framework is resulting in a deliverable for transportation safety implementation guidance for local agencies. So it's not a plan per se. It's not prescriptive. It allows for flexibility.
Great, thank you.
You're on mute.
So I was having trouble with my operator error. So Dave Hudson, I saw his hand up. Then
Teresa, if I could ask that you just stay with Renata and stay with La Miranda until they've spoken.
Okay, sounds great. Thank you for deferring. Councilmember Sauce.
Thanks, Dave, because my questions are follow-on to Amy's. Thanks, Eleanor and Terrence. Eleanor, do you mind putting the map back up, the pedestrian one?
Yeah, of course. Give me one sec.
Because I'm still trying to understand how this works. So let's just take Moraga Road, which the entirety of Moraga Road is blue. And so if I'm understanding the methodology, the algorithm identifies sort of places of where things have happened, right? And then but that doesn't mean that there have been incidents along, every point in Moraga Road. Is that right?
That's right.
Okay, and then conversely, and I think this goes to Amy's point, the fact that Moraga Way isn't blue past, I can't tell where that is. Let's just guess that's Miramonte High School. I don't know if that's right or not. Doesn't mean that there aren't incidents beyond Miramonte High School. It's just for whatever reason, those dots weren't connected. Is that correct?
Yeah, and maybe if I can add one additional, nuance is that because we're looking at, as Terrence said, we look at these small segments throughout the county, how many collisions happen on each segment. We do weight fatal and severe injuries more than collisions with minor injuries or no injuries, for example. And then we look at the number of tallies essentially on each segment, but compared to the whole county, and we rank it from highest number of collisions to lowest number of collisions, and we add each segment in until we get to a threshold, I believe, for the people walking, as we found out I need to look in my notes again. I believe we found out something along the lines that 80% of pedestrian collisions occurred on 20 or 10% of the roadways countywide. And so we added up all of the segments until we got to 80%, and that's what made it into the high injury network. So I feel like that's an important point to clarify.
Okay, and then, and is, one of the great concerns in our community, and I think Amy alluded to this as well, is pedestrian safety near schools.
Mm-hmm.
And is that a factor that gets weighed in on the severity analysis? Is, let's say it's a kid walking to school who's involved in the accident versus, just someone randomly walking down Moraga Road. You see what I'm saying? Because there are places where one can expect more pedestrians and a greater sensitivity near schools, near transit. Does that come into the calculus at all in identifying the severity location or the safety location?
That's a great question as well. And I think, so to clarify that, the age of the victim, for example, does not play into this exercise that we're looking at here. However, it is considered in multiple other aspects of the Vision Zero framework, of all of the work that we've been doing. So today I just had a few slides prepared to zoom in on this issue, but you will be seeing in the document that Colin mentioned, which I believe is set to be released in the fall, that we also highlight both seniors and school-age safety as kind of key issues across the county. So that's captured there, and it's also captured in the priority pedestrian area, as I mentioned, that came out of the bicycle and pedestrian plan, the countywide plan, that was also highlighted areas around schools. So it's certainly a large consideration. However, it's not specifically reflected in this particular analysis.
Okay, thank you. And just one more question, if you'll indulge me. So, and forgive me if Colin covered this in his last presentation, but that was more than a day ago, so I can't remember. So so what does this mean? What does it actually mean going forward if something is blue on this map?
So I think as Colin alluded to, this study to this point is meant to serve as technical assistance and provide information, guidance to local jurisdictions about how to think about these issues. I'm not sure if Colin wants to weigh in on how else CCTA might use these locations.
Yeah, I mean, I don't think there's anything that specifically says that, no other corridors that aren't on the map, so to speak, wouldn't be able to receive local funding or that kind of thing. So yeah, I think in general, the RTPCs and the CCTA board can discuss, what their priorities are, and continue taking this process forward. But it really is just a framework. It's yeah, I'll leave it there.
So so if I understand correctly, it's helpful if it's blue, but it's not fatal if it's not. I mean, in terms of prioritization down the road.
Right. There are areas that are not marked blue that can still, be invested in.
Okay. Thank you. Thank you very much. Thanks, Dave.
Welcome. Now you got other La Mirandas jumping in there. Teresa, you want to hit them all?
I was going to go to Sia next because I know that he has would want to stay on the La Mirinda discussion, and then Amy, and then Dave will go back. But Sia,
I have a general question, so I'm happy to go later. Whatever.
General.
Okay, Sia.
Thank you so much. So I have a question. I'm wondering if the data used for this map is normalized for number of pedestrians or bikers, if we have such data, because it makes sense for downtown Walnut Creek to have the most number of accidents. As we can see, it's all blue. But other locations like Lafayette, downtown Lafayette, that or other locations, let's say some locations in Orinda or Lafayette that are less used by pedestrians, it makes sense for them to have less number of accidents. So if the data is not normalized, then the priority will be given to locations that are already walking friendly and like pedestrians use them already, and less priority will be given to locations that we actually need more infrastructures to be built there. So what I mean is we may use number of accidents or incidents by number of pedestrians using them. By this means, we will have a ratio of accidents to pedestrians, and we may better understand whether it's downtown Walnut Creek that is very dangerous, or it is downtown Orinda that is very dangerous because we don't, or downtown Lafayette or some other road in Lafayette, because now we have normalized the data. So that's basically my question.
Yeah, thank you for your question. That's definitely excellent and like a very good and very insightful point. So we did not normalize based on pedestrian volumes for that pedestrian network, nor did we normalize for bicycle volumes on the bicycle network. The idea is that, you know, with Vision Zero is that even one fatality is one too many, and so there's always room for improvement. And so that's the rationale behind, you know, like including places that may already have some pedestrian improvements, pedestrian facilities, like you mentioned, downtown Walnut Creek is a good example, but you're still seeing those fatalities, those severe injuries, and those propensity for incidents. And I think with respect to you know, the second part of your question, which is how do we proactively make those places where people aren't walking safer and more conducive to those kinds of uses, I think I'll defer to Eleanor on that countywide bike and ped framework.
Yeah, I mean, that's a great point, Sia. And I think if the data, you know, were available, we'd love to follow up and do a deeper dive into that. So if anyone knows of data like that, please share that with Colin for future work. And then, yeah, with respect to, you know, that's, yeah, it's certainly a challenge. It's kind of similar to Amy's question about you know, under an interchange, at an interchange, you know, you see lower levels of people walking and biking in those locations. So that's something that came up in our collision analysis as well, kind of thinking through like these are locations that maybe don't see as much collisions, but it's something that we heard a lot in the countywide bike ped plan when we did public outreach. We heard that, you know, interchanges need improvements, as well as commercial areas, which I think you were alluding to. And so those are part of other aspects of the study, but not necessarily this safety network that we're talking about today. So thank you.
Thank you. And so Dave, we're going to go to you because Amy said she has the general question. So thank you.
Yeah, I wanted to hit on, I think Renata asked the key question. And that is, okay, you got the past, now what are you going to do in the future? This is, to me, just a lot of information. We get a lot of information. It was actually listed as pedestrian, where we have to separate pedestrian, bike, transit, whatever. And I'm just going to assume what you're really talking about is bike and pedestrian. I think we need to go back and don't put it up, but look at that map. It isn't just downtown Walnut Creek. All of Bishop Ranch is blue for the most part. What isn't blue is the Iron Horse Trail. So when you talk about what's the past and where we're going in the future, here's an area that has shown virtually no problems, and adding a lot of traffic there instead of like an overpass going over that should help, where you're not going across a major arterial, will help quite a bit. Does it make sense to think along those lines? I will engage anyone and tell you during COVID, the bike traffic on the Iron Horse Trail almost tripled. I mean, it's coming, and it's coming fast. Now, I don't know what you can do with Lafayette, Moraga, or Orinda separately or together. And I don't know I was almost going to say, Amy, do you really want to bring attention to that road and have more traffic down there? But somebody, you don't argue with somebody with an electric bike. They just know everything. So I have to let it go. But I think that if we take a look at the past and we see where some of the problems are, and then take a look at the solution and see whether it's worth it, that's where you're going to engage more than just CCTA money. That's where we start taking stuff out of Amy's pocket when she's over at MTC and ABAG and some of these other places. Correct me if I'm wrong, Lisa, but we're going to get almost $5 million for our overpass because it makes some sense. And that's the real indicator. It has to make sense to cut back to go towards that goal of zero. I guess zero fatalities, almost said zero emission. And I'll defer to Amy's general statement that will rebut everything I said.
Thank you, Dave. Go ahead, committee member. Word.
Thank you, Madam Chair. You know, I think this is recalling the conversations that we had about this report the last time we saw it. And so I think Sia asked my question in the way an engineer would ask. But I wanted to clarify the understanding because so when I can see how I could use this study if City of San Francisco wanted to look at the financial district and they wanted, okay, what are the bad corners? And they wanted to be able to tell the difference between Sansom in California and Front Street and Sacramento Street. I mean, you have a finite area where you have a common population. You're kind of doing apples to oranges, similar amount of cars, similar amount of pedestrians. So where are the bad places? And I guess I'm really trying to exactly understand this point about this 80%. So when you compare areas, say you compare La Miranda in terms of volume with, say, Concord and Walnut Creek and San Ramon, let's use those three cities where you have a lot of activity in certain areas. How do you really make a meaningful comparison so that you're not, maybe I'm missing something. I really am trying to understand this. But again, I think what we're looking for is data. The other thing I'd really be curious to see the whole countywide dots, just the dots, not the smoothing, but just the dots. Because then that tells us, okay, is a particular intersection really a problem? I mean, you see, for example, you see a lot of bike riders going on Willow Pass Road, from downtown Concord over through by the freeway, overpasses, underpasses, going towards the direction of Sun Valley Mall. So could you talk to me a little bit about how this methodology works when you're comparing such disparate areas in terms of volumes and really get something that's meaningful?
Yeah, that's a great question. And I may ask Terrence to weigh in on this too, but I'll give my 2 cents, which is that I think it's important to emphasize, I guess, the kind of goal of the study around Vision Zero. So I should have led with that, which is that the goal of Vision Zero is to reduce fatal and severe injury collisions, in an area over time by a set year, typically. That's, not, I don't think a year has been set. This is more a decision for local jurisdictions around creating that kind of goal. But with that kind of high level goal in mind, really focused on fatal and severe injury collisions, what this effort has been focused on is looking at all collisions to some degree, but a focus on fatal and severe injury collisions across the county. And then that has been the priority or kind of North Star of this investigation that we're talking about today. We unfortunately, are not looking at volumes of cars, volumes of pedestrians or bicyclists. I believe that data may not be available and hasn't been the focus of the study to date, but it would be interesting to kind of get at some of the questions that have been asked here today in terms of normalizing the data to current uses. And then the last thing I'll mention is we have internally created a map for CCTA that looks at those dots on the map like you were mentioning, so we can see if we can make that available to this group or some version of that for folks that are interested, for sure. And I'll see if Terrence has anything to add to that on the data side of things.
Yeah, just a couple more things. You mentioned in your question, the distinction between, like, is it a particular intersection or is it the whole corridor? And we really do go intersection by intersection, right? If it's just the one intersection, that's what we say, it's just the one intersection. But if it's also the next intersection and the next intersection and the next intersection after that, and you have 6 intersections in a row, that's when we say, oh, okay, if it's all 6, maybe it's, we should just include like this whole 6-block stretch that looks like it's, like the entire thing is in need of some work. And just because the collisions are, mapped to those specific intersections doesn't mean like the intervening stretches don't also need some work there. So on that map, you already do see those patterns sort of reflected. Like we're not going to tag like a whole corridor just based on what's happening in one specific intersection. And then
There has to be, we're kind of connecting the systemic issues across corridors.
And then regarding your other thought about just how it's normalized across the county, it's really just looking at like pure numbers, like how many incidents have there been and what are the severities. And so, in that respect, it really is an apples to apples comparison because we've divided these roadways into like small stretches. They're not like, oh, we're looking at like this whole corridor, like all of Moraga Road versus all of Willow Pass Road, for example. We're looking at like this very specific 100 feet section of Moraga Road and seeing, oh my God, there are 5 collisions that happened on this 200-foot stretch. And that makes it, that puts it, in the top, let's say 5% of all the 200-foot stretches of roadway across the county. And so we're just doing like an overall countywide ranking of all these little segments. And that's where the algorithm comes in. It's like, we don't know where, like what these 200 feet segments correspond to until we put it on a map and it's all highlighted in this dots and dashes.
Yeah, does that help, Amy?
I appreciate your help. And again, I not being an engineer, I'm at a disadvantage. However, I did, Madam Chair, can I just follow up with one question? So can you explain to me how you used, when you first started the presentation, you talked about the 80%. You said, okay, we take the worst. I mean, what would it, so I'm trying to understand what that piece of the methodology is, number one. And number two, if you just took all the accident reports, everything, all the data for Contra Costa County and put it on a map with dots, what would that look like? Not determining, I don't know. I'm just really trying to understand what this really is telling us. I mean, are you telling me that corridor from Camp Leona High School or from Moraga, and Renata, forgive me, I'm using your line because you got blue line here, and but that we have accidents on every single one of those intersections? I mean, is that what that says? I mean, that's the other challenge with the smoothing, is you don't really know what it means. So thank you.
Yeah, no problem. So if you take all the dots, like one dot for every collision in the county, and you just put it all on a map, first of all, you have a lot of dots, like really tragic, but you do have a lot.
Okay.
And so what you want to do is just like, where are the dots densest? Because that's where, like most dots per 200 feet of road, for example. And that's basically what we're doing. So each segment has a certain number of dots on it, and we're just ranking them from most dots on a segment to least number of dots on the segment. So you go from, let's say a segment's really not doing a good job serving its users, it's got 100 dots, and that's the top segment in all of the county. So that's ranked number 1. We rank it all the way down to like a segment that's doing great, no incidents ever in our study period. So that's a 0. So we go from, and we just start adding up from the number 1 most unsafe segment downwards until we get to 80% of those collisions. And that's where we stop and say, these are the most unsafe segments that contribute to 80% of those collisions in the county. And
I'll just clarify, we added up until we start adding the segments one at a time, like this is part of the network, this is part of the network, this is part of the network, until we see that the network reflects 80% of fatal and severe injuries across the county where they are most concentrated. And so the 80%, you know, some studies, maybe it's 75, maybe it's 80 is actually quite high. And I think what it shows is that pedestrian and bicycle fatal and severe collisions in Contra Costa are very concentrated in a few number of corridors, essentially across the county. And you know, as is common in these types of studies, we've worked with our working group, with outside technical experts and people from different jurisdictions across the county to refine these and figure out, you know, what is the right benchmark for this. And so I think in this effort, 80% came out as, you know, this feels like it captures the kind of most concerning areas.
Thank you. You know, I think for purposes of our area, it would be helpful to see the total numbers on a map. I'm just looking at, you know, given the fact that every accident is an accident, every death is a death, you know, so that would be helpful as we're trying to grapple with it. Just if we can get the dots for the whole county.
Yeah, we do have a GIS database that we created as part of this effort that will be available to all local jurisdictions. And then Colin can follow up. I believe there's a web map that shows what you're describing, and we can see if that's available as well.
And yeah, I think just one other note is, like, as you look at the data, you'll see like there really are like dots in more places than we might expect. It's tragic. So it's not to say like those places not highlighted in blue have no incidents. That's not what we're saying at all.
I mean, that's the challenge with just the limited blue lines. The assumption is everything else is fine. And I don't think that's what you're saying.
No.
So yeah, and we don't want to convey that. Okay, thanks.
Thank you.
Amy, and I see Committee Member Sauce's hand, and then Stepper, Vice Chair Stepper.
I think actually Karen was first.
Oh. Is yours general?
We just finished our bike master plan, and we have a lot of bicyclists who are been serving on this and have gone back for many, many years into the detailed reports of the California Highway Patrol. And I would say probably it's a really intensive effort to change the number of collisions, because every collision is an individual collision. One's from a bicyclist, one's from a car, one's from vision problem, one's from medical, there's so many different uses and cases here. So one of the goals is that once you have a collision that has been fatal and you're able to trace that down, which is not easy, it's how do you stop that from happening again at that major intersection? And just take, because if you can change each one of those down the line, they'll start to generate some travel patterns. But in the most case, you're trying to stop that from happening again, and stop it from happening again. Not necessarily the same one's going to be at the next intersection, but you're going to learn from that. And so I think this is something that's going to be much more difficult than just finding out where 80% of the collisions are, because they're so different, whether they're caused by the car or they're caused by the bike. But it's an effort worth doing, but it's not going to be something that's going to be simple. And I just wanted to call on the bicyclists to be a really big part of these solutions. So.
Thanks. Okay, Renata.
Thank you, Teresa. I just want to make sure that that we're on the same page about what Amy has asked for, because I would like to ask for it as well. And that is, again, I think I am personally struggling with reconciling the sites where stuff happened with the blue lines. And so if we could have something that either on the same page has both the blue line and the dots, or we can juxtapose two pieces of paper to look at that, I think it would really help me, because for example, I'm really struggling with Moraga Road, and that entire thing is a blue line, because Moraga Road is very different in different places. And there are parts of Moraga Road where I literally have never seen a pedestrian. So, I think that would be really, really helpful if we could see something that gives us the side by side. And Amy, I don't know if that is what you asked for, but I think that would really help both of us.
Teresa, if I can reply to
Yes.
her. Yeah, yes, it is. I think that is great. And I think Moraga Road's a perfect example. You know, Ream, you got this big, huge, wide highway with wide, 4 lanes with wide shoulders and everything. And then you go down to Lafayette and it twists and turns. But also, I think having also, in addition, having the total data on a map. I think that would, Renata, forgive me if you were also asking for that too. But I think that I think especially for our smaller jurisdictions, it will be super helpful because statistically, we just don't have the volumes that other areas in the county do. So I think, thank you. Yeah. Thanks, Renata. Yeah.
Okay. And I think what I heard Eleanor say is that something like that exists. And so they will work with Colin and CCTA to make that available. And are there any other comments? I do know that with committee member Stepper's comment about the cyclists, Colin, can you speak to how the cyclists and other stakeholders have been engaged? I know this is one piece of the guidance and the plan, but can you speak to that?
In terms of bicycling advocates, is that what we're asking?
Yeah, so and just other stakeholders in the process of developing the guidance and the framework.
Sounds good. So Eleanor, I'll kick it off to her as she was involved with the outreach process as well. But the outreach process included, going to all of the different regional transportation planning advisory committees, the technical advisory committees, and the elected committees. So each of the 4 subregions. Also, the Vision Zero working group, which Eleanor mentioned, has UC Berkeley Safe Trek director, MTC, and others represented on that group. We, including Dave Campbell from Bike East Bay, for example. We meet quarterly with bicycling advocates on design, partial design projects to help inform the design process. I'm not sure that there's many other public agencies that do that to that level, so that's really good. What else in terms of bike advocates? Yeah, we did go to the County Sustainability Commission as well to gather feedback, a number of others as well. Eleanor, did you want to add?
I think Colin really covered it. I'll just note that as part of the countywide bicycle and pedestrian plan, which we updated in 2017, 2018, which was like an earlier effort, that effort did have a lot more public outreach. We did pop-up events all across the county, online surveys, online workshops, lots of different avenues for people to weigh in. And so, certainly some of the findings from that work are carried forward in this Vision Zero action plan, or Vision Zero framework, excuse me. But Colin mentioned the main stakeholder engagement for the Vision Zero framework has largely been the Vision Zero working group, which we've mentioned a couple of times now. We've interfaced with CBPAC, Countywide Bicycle Pedestrian Advisory Committee, as well as the various RTPCs. So that's been the main focus for this effort. It's not a public engagement effort for the Vision Zero framework to date.
Okay, thank you. And any other questions or comments before we say thank you very much and move on to the next item? Okay, so we'll move on. And first of all, thank you very much. And thank you for coming back, Colin. And thank you, Terrence and Eleanor, for bringing back the data. And I know that you, and for providing the information that was requested by a number of committee members. at your earliest convenience. And we look forward to continuing to work with CCTA and you as we move forward with this process and implementing these the Vision Zero framework and various elements for our communities. So thank you.
Thank you so much.
Thanks for having us.
On to item 6B, I saw John Cunningham turn on his camera, his video. And so we're moving on to the Contra Costa County Accessible Transportation Strategic Plan update. And John Cunningham from Contra Costa County will be doing this presentation and update. Welcome, John.
Great. Thank you, Chair Geringer. Excuse me. Hello, members of the committee. Yeah, I'll be presenting the Accessible Transportation Strategic Plan, which I will refer to as the ATS plan. We have a team of folks working on this. It's being led by the Transportation Authority and Peter Engel, the Director of Programs at the Transportation Authority is the project manager. And we also have Nelson Nygaard, our consultant team. And so we take turns presenting, and today you get me. So what is the Accessible Transportation Strategic Plan? This is a repeat for a number of folks here as I'm looking at the gallery, so I'll move along, and at the end I have some updates for folks. But the ATS plan, we are looking at how to improve transportation for seniors, persons with disabilities, and qualified veterans in Contra Costa County. That's to put it simply. So again, this study is a joint effort between the Transportation Authority, who is the lead, and Contra Costa County. It's funded by a Caltrans Sustainable Planning Grant. And so the third bullet here is really sort of cuts to the chase, which I'll go over in detail at the end. But the study recommendations were to create a coordinated entity to oversee this topic in the county, and I'll sort of connect the dots here as we get there. And then the study is actually complete now. It was adopted by the Transportation Authority, I think, in January, and so we're moving into implementation, which again I'll get to here in a minute. And so the background of the project, we had plenty of sort of policy direction to get this thing going. The 2016 and 2020 sales tax measures directed staff to conduct this study. And then in addition to the countywide transportation plan had a recommendation that we conduct this study as well. And if that's not all enough, the MTC passed a resolution directing, I think it was Solano and Contra Costa counties, to establish a mobility management program. And so this study also fulfills that direction from MTC. So the ATS plan was overseen by two committees, which we're used to in this county. One is the Technical Advisory Committee, and these were sort of the hands-on folks that have operational knowledge of the various forms of paratransit, accessible transit in the county. We had transit district staff, we had some city staff that participated. Becky Adams from the city of San Ramon was a very active participant. And those folks just sort of directed us on the nuts and bolts of what's possible. I just got a message. I am not sharing my screen. That would probably help folks.
You're not.
Thank you.
Thanks, John.
No, there it is. Can folks
when you said
see that now?
Bullet point, you were doing great in getting the information out to us, but when you said this bullet point, I realized that you weren't showing it. So carry on.
Thank you very much for that. And so, yeah, so the oversight structure, the TAC, and then we had a policy advisory committee. Some of these folks are on this call right now, but they're executive folks and elected officials. We had the executive directors and general managers of the transit districts, AC, Tri-Delta, West Canton County Connection, and then we had CCTA board members. We had members from the board of supervisors to give us, policy direction and sort of generally point the study in the right way. And so as with any large study like this, we take a look back and say, okay, what's been done before? How do we need to do it differently? And with this particular study, this county has conducted 3 similar studies in the past 30 years. And Unfortunately, most, if not all of the recommendations of those studies, they were never implemented. They're sitting on a shelf. And so that was sort of a theme as we proceeded with this study, just to sort of keep ourselves honest and put the pressure on everybody that, you know, there won't be much tolerance for, you know, a plan continuing to sit on the shelf. And so we focused very much on implementation. Okay, we're going to get this study done. How do we move ahead once the study's done? And I'll get to that here in a little bit. And so why has there progress been elusive in this area? And you see some bullet points here. And really, it's a situation where there are a number of different types of agencies providing this type of service, and they're all speaking different languages. You have nonprofits, you have public sector, there are social service type programs, health and human services, you know, ADA public transit, and really, and so you see some of it here in the bullet points. There's different revenue streams, there's different regulatory requirements, and those are all sort of barriers to building coordination. And sort of the last bullet point there is probably, it's a good sort of defining barriers. There's really nobody in charge of this service area. It's very dispersed with no clear leadership. So CCTA and the county, you know, we got together, applied for the grant together, and we are conducting the study together. So, and this map, these next couple maps actually sort of show you the disparate agencies and types of service that, you know, it's overused, but it's herding cats, really. There's different types of agencies, different missions. And here you see the medical field is the same, really. They have different responsibilities, and both in California and at the federal level with the Affordable Care Act, transportation requirements for health insurance providers have been increasing over the years, and that increases the silos in transportation.
Yeah.
And so outreach, this study, and we've all gotten used to this story. We started this study right as COVID ramped up. And even before COVID, when we put the study path together, sort of the plan for the study together, we wanted to do a lot of outreach. And we received that direction actually we did a bunch of pre-outreach to the transit districts. And that was one of the comments that we received from the transit district. Look, we've done this before. Can you please go out and try and get more input from the actual users? You know, there's a number of advocates in the community which are very vocal, and that's great. That's a positive thing. But we want to hear from the users. And so we really tried to go above and beyond with our outreach. You can see here we did a survey that was distributed by the transit districts, by the city programs, and we received 1,000 surveys back. We had a number of stakeholder interviews where we got together a group with sort of, you know, senior services commissions. The community college district has a very active disabled students alliance that we met with. And so we had a telephone town hall. Those familiar with the CCTA processes are familiar with those. That was very successful. And then social media, of course. And I'm really happy, you know, the city partners, other agency partners really jumped in and helped us out and broadcasted this study. And so moving on to what we found. And so there are, with all the interviews and stakeholder interviews, we found a number of gaps and needs, and some of them are listed here. And you can probably guess some of them: conventional transit service, the ADA mandated paratransit service. You know, people would like more of that, although that particular service area has significant, I guess, regulatory constraints. And then, you know, both people wanted transportation in a wider time frame and also in a wider geographic area. Stuff you could probably guess if you had to. And here's some specific details on what people wanted. Same-day trips are difficult to schedule. ADA paratransit regulations don't require same-day trips. And so if you want to take sort of a spontaneous trip, that's very difficult to do in this, not just this county, but frankly, many other counties. Quick aside, Contra Costa is not by any stretch the only county that's having problems improving and making progress on this. It's a Bay Area-wide, statewide, nationwide issue. We're not alone, so but we are making progress here. Getting back to the slide, another finding that we had was veterans transportation programs. Even our very experienced consultant team with Nelson Nygaard, they have never dug very deep into veterans transportation issues before. And with this study, it was in our scope, and they interviewed a number of people and really found out that veterans face similar, if not even more significant barriers to transportation. The VA provided transportation is much more restrictive in terms of days and times, and even the use of the trip, what they're using those trips for. And so that was news to us. And then some of the other ones you can see here is East County is limited just because there's limited transit service period out there. It's rural and agricultural. And then the bottom bullet is I spoke to earlier, when there's diffused responsibilities with no clear leadership. That's something we're going to get to in the recommendations, which I'm going to get to here with this slide. And so, and that top recommendation there, establish a coordinated structure that addresses sort of the big systemic barrier that we've had, and that there's no clear leadership, no clear authority. And so the recommendation is we need a coordinated entity to oversee this topic area, this service area as we move ahead. I guess there's one hitch, is there's dozens of different possibilities on how to have a coordinated entity. You could have an existing agency provide the service. You could have a joint powers form to oversee the service. An existing nonprofit, expand their responsibilities, or stand a new nonprofit up, specifically designed for this. And there's combinations of all of those. And so what the recommendation is, we're forming a task force right now to oversee. They're going to select which model that we're going to have as a coordinating entity. What's going to work best? I believe the task force is going to look at some best practices from the Bay Area, the state, around the nation, and see if there's something that's a good model that we can sort of mimic here in the county. They have the task force and the coordinated entity definitely has other implementation steps. The other big one, in addition to the one systemic problem, we don't have anybody in charge. The other systemic problem is the lack of funding. We need a dedicated ongoing revenue stream, frankly, to improve this service area. And so that's a big lift that they have to take on. And then some of the other bullets you see here are some of the more operational programmatic issues that need to be addressed. And we need to address them in the short term. Some of them we can do without funding. Most recommendations do need some additional funding, however. And you can see these listed here. Mobility management, which is really just sort of a travel agent for accessible transit in shorthand. There can be joint paratransit scheduling software purchasing between all the different players. Right now, everybody does their own purchasing of software. It's very expensive and they don't always talk to each other. So if folks can do it jointly in the county, we can get interoperability between software and probably save some money. And then advocacy type initiatives. And then there's a one-seat ride program that County Connection is piloting that we want to take a closer look at, and so on and so forth. And some of these I already covered here. The one-seat ride program, same-day trips, volunteer driver program is very critical for cost control and improving the quality of service, shopping trips, hospital discharge. And then here's probably the one other big systemic improvement that we're looking at, and that is to have a one-call, one-click type of service. And that means right now in the county, depending on what city you're in, what area of the county, and there's a different number or different website to go. Well, we want to do away with that and have one website and one phone number. And we won't send people around. Oh, you got to call here. You got to check in with this person. It's going to be a one-stop shop. I think the HHS type folks call this the no wrong door policy. It's like you get somewhere and you're going to get connected with the service. We're not going to send the client, the constituents around from website to website. And so next steps, We're moving into implementation right now. We need to seat the remaining task force members. What we're doing with the task force is really we're trying to replicate the existing policy advisory committee. And so we're taking most of those folks have been engaged since the beginning. They're knowledgeable, move them over to the task force with a couple of modifications. And one of the modifications is each RTPC is going to appoint a member to the task force as well. So you'll be receiving communication from CCTA here probably in the next week or so, asking you to appoint a member to this task force. And then we'll convene that task force probably September, October. And then in the very near term, on July 28th, the study team, myself, Peter Engel, with the Transportation Authority and our Nelson Nygaard consultants are going to be presenting the ATS plan to the county's Measure X Community Advisory Committee. And so if you're not aware, the county passed a half-cent sales tax to help serve sort of the vulnerable members of the community. And this study and the recommendations do fulfill that role. So we're putting a presentation together to provide at the meeting on July 28th. And that concludes my presentation.
Thank you. And I see committee member Stepper has a question.
Thank you very much, John. This really helped a lot to hear it verbally because there were all these pieces and I've been here long enough to have seen all these different things that you called sitting on the shelf. And I thought, well, that's refreshing because that's exactly right. Because we have here very clear that medical is the main thing that they use this for. And that's all over the county and they go 1,000 apparently different places. So my question to you is if we can take the heaviest need, whether it's a veteran or a disabled or a senior, and if it were medical, how we could envelop that in the new world we live in, which is my doctor doesn't want to see me. He wants me to come by video. He wants me to come by phone. And then when I come by in person, it's a different answer. So it's changing the numbers and how they get to their doctors and how they meld this with other trips. And so I don't see that part kind of, although I heard it from you, that it requires some coordinated software. And maybe it requires a nonprofit that's willing to shift through those differences so that we don't have as many needs for the vehicle, so to speak, but we're getting the service taken care of. So actually, from what you said today, John, I'm excited about what you're saying and I appreciate what you're doing.
Great, thank you for that feedback. And we just got MTC sent out a survey asking sort of along the lines of what you just mentioned. It's like we have a changing dynamic relative to service provision. How are you seeing that play out in the environment? So they're compiling that right now.
Excellent. Thank you.
Thank you. Committee member Candace Anderson.
Yes, well, and I want to thank John. I did have the opportunity to work on this as part of the PAC, and it is a challenge, but we're seeing so many good things. For those of us who sit on County Connection, which Amy and Dave, although there's Dave's over there, we've seen, what Rashida's been able to do with County Connection, which is to have individual cars in essence, rather than sending the big van that's going around picking up lots of people. It's being able to get people there quickly without stops, moving it. And then you have these amazing service programs in La Miranda that just are astounding, that are, not just door to door, but beyond. And so I keep crossing my fingers that we're really going to find the right nonprofit, because we think that's going to be more efficient than having a government entity do this, really bring together everything we have there be this one number that everyone knows to call, and then we'll be able to get the right provider to provide the ride. And I'm hopeful, John, that you have applied for Measure X funding. I don't know if you've had that opportunity, because to me, this is the time to do it when we've got that funding available. It's a critical component of what we're trying to accomplish. And I know you've got some strong buy-in from the Board of Supervisors already on this program. So I'm hopeful that that will be the case. And then of course, there are other grants once we sort of have the shell of the program really moving forward. So I appreciate your and Peter's perseverance on this, but for that, it would not be moving forward, but all of us want to see this be successful.
Thank you, Supervisor.
So are there any other questions or comments? Seeing no one's hands raised, I also want to echo the thanks to John and Peter and for moving this forward, because I agree with Supervisor Anderson. It would not be happening, continuing the momentum out of the PAC without the work that you are doing. And I do want to say that I saw that it was a September, October hope for the first meeting of the task force, and I would love that September end of that. I also, along with Supervisor Anderson and Mayor Hudson, served on the PAC, and then as chair of CCTA this year. This is, one of the priorities that we want to keep moving forward. And so I echo all the thanks and the excitement, and thank you for coming today, John, and giving us an update.
Great, thank you.
Thanks. And we will move on to regular agenda item 6C, approve consultant agreement for SWAT website design, development, and maintenance services. And Lisa Bobadilla, you are presenting this, and take it away.
Yes, great. Thank you, Madam Chair. Good afternoon, SWAT members. The item before you this afternoon is a recommendation from SWAT TAC to hire Blink Tag for the SWAT website design, development, and maintenance services, and to authorize staff to enter into an agreement with Blink Tag effective August 2nd, 2021. If you'll recall, on March 17th of this year, SWAT TAC approved the final version of a website design, development, and maintenance services request for proposal, or RFP. The purpose of the RFP was to secure a vendor to redesign, host, and maintain a new SWAT website and related system. On April 5th of this year, SWAT approved the final SWAT website RFP. Subsequently, the RFP was emailed to potential bidders on April 6, 2021. The notification of the RFP was also posted to the SWAT website. We received a total of 4 vendors by the due date of May 6th who submitted an RFP. They were Blink Tag, Decode, Planetaria, and WebDogs. On May 19th and 20th, SWAT TAC held interviews with 3 of the 4 consultant teams, Blink Tag, Planetaria, and WebDogs. Decode was not asked to participate on the oral board as they did not meet the RFP requirements. Based on the interviews held, the ranking of the proposals, and the total scores for each consultant, SWAT TAC is recommending Blink Tag. Blink Tag has significant experience developing and supporting various websites throughout the Bay Area, including here in Contra Costa County. For example, Blink Tag currently provides website services or has provided website services for 511 Contra Costa, BART, County Connection, and Marin Transit, to name a few. The total cost for the website design per SWAT jurisdiction is $1,670 per agency for fiscal year 21-22. The $2,000 annual maintenance service contract is included in the SWAT administrative services contract, which you approved earlier this afternoon. So therefore, SWAT TAC is recommending that SWAT approve a contract with Blink Tag for the SWAT website design, development, and maintenance services, and that agreement would be effective August 2nd, 2021. Upon approval and implementation, we will provide SWAT with a demo of the new website either at the October or November SWAT meeting. So you'll be able to see it before it's actually launched to the public. So with that, I'd be happy to answer any questions that you may have. Thank you.
I will move the item. Lisa, thank you for the comprehensive written and oral report. That I'm very confident that you've really vetted this well and comfortable with your recommendation.
Thank you. Do we have a second?
I'll second.
Okay, thank you, Committee Member Sauce. And are there any members of the public? I just looked at the list and didn't see any, but I will still offer anyone who would like to make a comment. And do any committee members have any questions or discussion? Darlene, will you please call the vote?
Yes. Committee Member Hudson.
Aye.
Supervisor Anderson.
Aye.
Committee Member Worth.
Aye.
There you go.
There, thanks.
Committee member Soft,
Yes.
Vice Chair Stepper,
Yes.
Chair Garinger.
Yes.
All right. Okay, passes 6-0.
Thank you. And thank you again, Lisa, for all the work on that and the detailed report. And we look forward to seeing the product at the October or upcoming meeting. So item number 7 is written communications. There are a number of reports in your packet. It didn't, unless staff says I didn't notice anything that would require any action, they're there for your review. And we'll move on to item number 8, discussion of the next agenda. And Lisa or Darlene, who will give any updates? I did hear one item that I'm hoping, and I'm sure will be coming back, will be to appoint the member of the task force for the accessible transportation plan, that would come back at our next meeting on the agenda. Are there other items?
Yes, Madam Chair, we will likely have an update on the TDM, the fiscal year 21-22 TDM program and budget. And we will bring this item, the appointment to the ATS study. We'll coordinate that with the Transportation Authority staff. And we may also likely have an update on the action plan. The authority later this year will be releasing a call to update the action plans. In fact, we're meeting with the consultant this Thursday, the RTPC managers are. So we may have an update on the next steps to update the action plans at the August meeting.
Okay, great. Thank you. Are there any other committee members have any other items? Mayor Hudson, were you throwing your hands up or raising them? Okay, seeing he hasn't unmuted, we will move on to adjournment. And thank you all very much. We had a lot of great reports today, and thank you all for your wonderful questions. And we'll see you on August 2nd, or hopefully before. But
Great.
Bye, everyone.
Bye.
Bye.